The MAVORIC study, it's a randomized phase 3 trial that was conducted internationally, multiple sites across the world, that enrolled patients with two particular types of cutaneous T-cell lymphoma called mycosis fungoides, MF for brief, and Sézary syndrome. Is the largest randomized clinical trial ever conducted in CTCL. It enrolled 372 patients. The patients that were enrolled in this study are patients with refractory or relapsed MF or Sézary syndrome that had failed at least one prior systemic therapy. So the randomization on the MAVORIC included a control arm, which was with a drug called Vorinostat, also known as Zolinza, that's a commercial name. And the novel therapy, the investigational arm, was with a monoclonal antibody called Mogamulizumab. So that's kind of the design of the study, was a one-to-one randomization. Half of the patients got Mogamulizumab and half of the patients got Vorinostat. For the Vorinostat arm, there was an option of so-called crossover. So in other words, patients who ended up on the Vorinostat arm and they were progressing or they were intolerant of the drug. After a process of central review, they were allowed to transition to move onto the other arm on the Mogamulizumab, and that's important in terms of the assessing the response rate, particularly to Mogamulizumab, even though it makes the assessment of survival endpoint more complicated, right? Because patients maybe getting two different drugs. And therefore, we were observing patients sort of transitioning continuously from one treatment to the next, with no treatment really taking hold, and producing very durable responses. That's where really the unmet need is in CTCL, and this is the population of patients that the MAVORIC study really wanted to address.